I've had, I could just, I think people, because I got so many messages on the reel that said the surgery, and people, and I don't know if the communication before surgery is after surgery you won't leak urine. I think that's the goal, but that doesn't always happen. And I'm sure doctors are giving percentages instead of saying, yes, you will not leak urine. And that's kind of hard to say in the medical field no matter what. But maybe some doctors are saying that. I don't know. But yeah, just because you have surgery does not mean that that prevents you from having prolapse in the future. And it does not prevent you from leaking urine because surgery does not teach you anything, right? It fixes the problem. Band-Aid solution does not fix the habits, the pelvic floor strength, all those things. So that's why surgery should always be paired with pelvic floor rehabilitation. I hope that makes sense. We have to learn how to not prolapse again. We have to learn how to use our pelvic floor muscles to function without. Thank you. So cute. He goes, here you go. Here you go. So you have to train your pelvic floor muscles for what they're actually meant to do. And surgery is traumatic and can create scar tissue, and so there's lots of things that we need to address after surgery. We have surgery after, we have rehab after we get our knees done, our hips done, our spines done, our elbows done, our fingers done, our shoulders done. Just not anything that has to do with, our poop and pee. Right? Yeah. Say hi. What happened? And with urgency, I don't think people think that's just, they just believe that's how their body is. They've dealt with urgency for so long that they don't think there's any way to overcome it. And urgency, it has really not a lot to do with the pelvic floor. I don't want to say nothing to do, because I think strength can always help, but it's a nervous system issue. So when I say urgency, like panic peeing, this overwhelming need to get to the bathroom, something normally triggers it, and then you're like, I have to get to the bathroom now or I'm going to leak urine. So what we do is we panic pee, we rush to the bathroom, which is just dumping gasoline on a very lit up nervous system. So we're making it so much worse. Remember, we train our bladders for how they behave. I hear my daughter singing upstairs. It's so cute. So she's so loud, and she's so how. And I had urgency so bad. My trigger was typically seeing the gym doors. I would full bladder empty. Like there was no more panic peeing. It was just I was triggered by the gym doors, and I would immediately empty my bladder. But there wasn't a ton in my bladder because I had just gone to the gym. It was always leaving the gym. And I had poured urine basically as I ran on the treadmill. So I had urgency significantly, and it was one of the hardest things to overcome, that and the pelvic pain. But you can train it, and you can absolutely make it so you are the boss of your bladder. One thing to ask yourself is, do you have control? Can you stop the flow of urine if you're in a situation where you're not sitting over a toilet? Urine should not leave your body without permission. So we should have control. And so this was one of the questions my pelvic floor therapist asked me when I started pelvic floor rehab. Because I had been on medication, I had done surgery, nothing worked. So you can imagine what kind of patient I was when I walked in there, and she was like, we're going to breathe and work on your habits and your muscles. I was like, right, that's not going to work because medication didn't work. And so one of the things in my mind, there were things that weren't a big issue because there were bigger issues. And she said, do you have control? Do you feel in control? Is your bladder the boss of you? Does it dictate what you do during your day? And I was like, it's what I think about all day. It's my bladder. She's like, and that's what we're going to change. And from that day on, we did. So I have this free masterclass. Make sure to join me, and we can learn more about your pelvic floor and bladder health.